Okay, so it's about an hour before surgery. I am getting a bursectomy, I think is the proper term. As you can see, one of these knees is not like the other. So my left bursa continues to be swollen and aggravating and tender. After a year, I've dealt with this. I had an accident at work. I came down hard on my knee and didn't notice it initially until a few hours later. I was kind of rubbing my knee, just almost not even thinking about it, and then realized how swollen it was. And it was probably 2 to 3 times bigger than it is now. Very swollen right here, very full with fluid, almost tight because all the skin was just stretched. And proceeded to drain it. I had a doctor drain it. It filled right back up. Drained it again. It filled right back up. And then ended up going to a sports medicine doctor where we drained it. Well, first we did an MRI and an x-ray, and there was no issues except for just the fluid in the bursa. Normally it seems like, from what I've heard, that normally you drain it and it just goes away, but sometimes the bursa just gets too aggravated, or I don't know exactly what the physiology is, but sometimes it just doesn't work, like in my case. We did do a round of, I believe it was doxycycline, an antibiotic, and that we drained out the fluid. Sorry, that's my dog drinking. We drained out the fluid and then filled up the bursa with the doxycycline, let it sit for an hour, and then drained all that out, hoping that that would potentially take care of it, but it just seems to keep filling back up with fluid and still is just aggravating. And it's not super painful, but it's annoying. It's tender. It's I can tell that there's more fluid in it, so it like makes it harder to kneel. Just kind of everyday life is just it's just an annoyance. And so finally we've gotten to the point where we're going to remove it. Hopefully I can get some footage of the surgery. I'm going to be knocked out, but I'm going to ask the doctor. I doubt it, but in case I do get it, I will include that. And then I'll also do a couple sort of post-op videos as well. I didn't see a whole lot on YouTube for this surgery, so I thought I would maybe share my experience. Trying to think if there's anything else that I'm missing. So they're basically, what they're gonna do is they're gonna, I believe, make an incision about there, open it up, and then dig out the bursa. The bursa is sort of a sac type thing that sits on every joint, has a bursa. It's not necessarily filled with anything. I don't know exactly how it works, but every joint has a bursa. It does play an important role, to the point where if you remove a bursa, your body will actually grow it back. So that's the idea, is remove this one. It's 4 to 6 weeks recovery, and then eventually, I don't know when, but eventually my body will regrow the bursa on top of the kneecap there. This obviously is a normal knee. There's no fluid there. This one's almost starting to like firm up a little bit, because the bursa does try to like heal, and so inside the sac it starts to like have these like fibers and connective pieces and whatnot trying to kind of close itself up, but mine just can't do that successfully. I don't know. That's kind of how I understand it, but ultimately it's annoying. It's sort of painful. It's tender. It's caused me to start like favoring my knee and just not being able to do things like going snowboarding and working effectively. I'm a firefighter, and so it's important for me to be able to just run around and not be worrying about my knee. So eventually we've come to the conclusion that surgery is the best option going forward. So I'll try to do my best to get a clip of what goes on in the surgery. Again, I doubt it, but I will see you on the other side. All right, day after surgery. Unfortunately, I wasn't able to get a clip of the procedure, but I will post in the description a video that I think shows it pretty well. It went well, it was quick. Doc said it came out pretty easily, so we didn't have to really dig in there. As you can see, thank goodness, he did not put me in a straight leg brace. I was expecting this big bulky thing holding my whole leg, and for whatever reason they didn't. So it's nice because I have mobility. I can move it around, bend it, twist it, turn it, and not in pain. Probably mostly due to the Percocet. I still do have a little bit of nausea. I think that's mostly from the anesthesia. So I did throw up a few times on my way home, and then since been home. Mostly when I'm like moving around. If I'm in bed, I'm totally fine. But yeah, I've been able to mostly get around and haven't been super hungry. Didn't sleep too great, but all in all, it's not too bad. Really glad I did it. It wasn't all that bad, and I'm hoping for a quick and speedy recovery. So what I'll probably do is do one more clip after my follow-up, which is in a week. I don't know if they'll take this whole thing off. I think they'll probably keep it wrapped, but they'll probably just want to inspect the knee and make sure everything looks okay, the incision looks okay. They may have to drain it again if there's just any sort of like blood or anything that kind of fills up that space that's no longer taken up by the bursa. Anyway, yeah, that's about it. Happy to answer any questions. And I'm hoping for a quick and speedy recovery. Thanks. All right, quick update. It's been 1 week. I go in for my follow-up tomorrow. Definitely a lot of fluid in there. You could see it jiggle. I imagine we're going to drain all that out tomorrow, so hopefully no more fluid. You can see the incision site in reference to the other knee, kind of approximate size. Here's my hand. Looks like they glued it instead of stitches, which is interesting. It's been sore, strangely enough, like on the side, even right here, even pushing down, like it's still quite tender and sore. I imagine if I could get past the fluid and push down, it would be pretty tender and sore there too. Right here is fine. Oh yeah, I can feel the kneecap there. Up here is okay, but mostly on that side. So I end up sleeping kind of on my stomach with kind of my leg flat like that, or just on my back, which is a little hard for me, but I'm managing. Yeah, so I've just been taking ibuprofen. I got prescribed Percocet and used those up in however much time I had them, and seems to be okay with just ibuprofen. But I have, like, the past few days, it gets kind of warm, not like infection type heat, but it definitely is just kind of warm and annoying, and so I've been icing it, and very seldom, once in a while, I will take the bandage off to kind of air it out and just let it breathe for a minute, because it's just always suffocating. But as I have been instructed and as I understand, compression is key, so I have been trying my best to keep it in the bandage, compressed. The bandage is not a very good one, so I've had to kind of redo it a few times. Anyway, just thought I'd do a quick update before I go in tomorrow for my follow-up. All right. Marley's going to town on her bone. I thought I would do just one very last update, if you will. I honestly can't remember the last one I did. But after this video, I'm gonna go find all the videos I made, stitch them together to kind of show, I guess, a time lapse, if you will, of this. And obviously this is mine and may not happen to you. There may be complications. Your scar may not look as bad, I don't know, or worse. But this is my surgery, my results. Your results may vary, yada, yada, yada. But I am happy to say that there is no more fluid, maybe a little bit, but I mean, hardly noticeable. Yeah, and I'd say I'm about 80 to 90% strength back in my knee. Obviously the bursa itself doesn't do anything to the muscles, but as you favor it and, you know, maybe don't do as much physical activity because you were, you know, not able to or whatever, your muscles are weaker. So my buddy actually went with his wife and a few other buddies on a backpacking trip today, and I didn't go because I'm not 100% to where I could carry a 40-pound pack for 10 days. So it's unfortunate, but it's fine. I'm still going on plenty of hikes. I can do several miles with a light pack just fine. It'll maybe be a little sore, a little tired, maybe is the better word, I don't know. But slowly and surely getting strength back. So anyway, very happy with the results. I would do it again. I would recommend it to anybody with similar circumstances. And I hope it goes as well for you as it did for me. So anyway, good luck if you're getting the surgery.